Do you know what colorectal cancer is? Well, it is a cancer that forms in the colon or the rectum, but thanks to improvements in prevention and detection and treatment, more than 1 million people in the United States count themselves as survivors of colon or rectal cancer. By watching this presentation, you will be able to evaluate your risk and learn what you can do to reduce your chances of getting colon cancer. Colon cancer is the third most common cancer in the United States. According to the American Cancer Society, 96,830 new cases will occur in 2014. Your lifetime risk is 1 in 20 of getting it. 50,310 deaths are expected to occur in 2014 from colon cancer alone. You have a 90% survival rate if you have a localized staged colon cancer. You will have a 70% survival rate if it is in your lymph nodes or surrounding organs. So as you can see, if caught early on or if you have preventative measures, you can reduce your odds of getting it. The gastrointestinal system is the beginning of the digestive system. It is made up of your stomach and small intestines, and they process food for energy. While the colon and rectum absorb fluid to form solid waste, and then it is excreted from the body as fecal matter or stool. After food is consumed, it travels through your esophagus to the stomach, and there it is broken down and sent to the small intestines. Here food is broken down even further and nutrients are absorbed. The small intestines connect to the large intestines, and the colon is part of those large intestines. The colon is approximately 5 feet long, and it absorbs water and salt from the food matter, and it is the storage place for waste. If polyps form, it will attach to your cell wall. The wall of the colon is made up of several layers, and colon cancer begins in the innermost layer and can grow through the other layers. Knowing the layers will help in understanding the stages of cancer. Most of the time, this cancer takes years to develop. First, polyps will form, and they can be either benign, non-cancerous, or malignant, cancerous. Finding the polyps in its early stage before it becomes cancerous may prevent the cancer from forming, and not all benign tumors will turn into cancer. Are you at risk? Are you over the age of 50? 90% of colon cancer cases occur in people over 50 years old. Males have higher risks of colon cancer than women. Most cases of colon cancer occur in people with a family history. 1 in 5 people develop it if they have family members that have had the disease. Colon cancer is found more in black males than any other race in the United States. People that are overweight tend to get colon cancer more frequently. People that exercise at least 3 times a week will reduce their chances greatly of getting it. Do you smoke? Smoking subjects people to the chemicals that are in the cigarettes, which may cause mutations in DNA, which then causes cancer. People that have a history of inflammatory bowel disease are at greater risk. Having type 2 diabetes increases your risk factor as well. The good news is that there are many things that you can do to improve your odds of not getting colon cancer. Diet is of great importance. By reducing your intake of red meat and the amount of alcohol you consume are good healthy decisions. Reducing your weight by increasing fruit and fiber intake helps as well. Beginning an exercise program under the supervision of your physician would be of great help. Limit or stop smoking as well. Signs and symptoms could be unexplained weight loss, change in bowel habits, bright red or dark blood in the stool, constant tiredness or fatigue, abdominal pain, gas, bloating or cramps, diarrhea or constipation. If you have any of these symptoms, see your physician immediately. This is an image of what a normal healthy colon lining looks like. This was taken during colonoscopy, which is a medical test using a colonoscope, which is a thin, flexible, lighted tube with a small video camera on the end. It will go through your entire colon looking for polyps and abnormalities. It can also be used to remove those polyps during the procedure. Biopsy samples can be taken during a colonoscopy and sent to a lab so the tissue samples will be viewed under a microscope and tests will be performed. Blood tests. Blood can be drawn in order to check your complete blood count, liver enzymes, or tumor markers. Colonoscopy tests mentioned above, a CT or a CAT scan, which are computerized tomography that is an X-ray test that produces detailed cross-sectional images of your body, a PET scan, which is a positron emission tomography scan, where a radioactive sugar is injected into the blood and cancer cells grow quickly, so they will absorb this radioactive sugar. Then after about 30 minutes, you will go through a scanner where a special camera creates pictures of the areas of the radioactivity that is in the body. An MRI is a magnetic resonance imaging. It produces detailed images of soft tissue in the body by using radio waves and strong magnets instead of X-rays. An ultrasound uses sound waves and echoes to produce pictures of internal organs and masses. This is an image of a colon lining with cancer cells. There are a number of treatments available if you are diagnosed with colon cancer. Discussing your options with your physician is the best way to come up with your treatment plan based on your stage of cancer. Surgery could be used to remove the polyps or masses. Chemotherapy uses drugs that are injected into a vein or by mouth, and they enter the bloodstream and reach all the areas of the body to kill or stop the spread of cancer cells after surgery. Colectomy is a surgery to remove all or part of the colon. Radiation therapy uses high-energy rays to destroy cancer cells. Clinical trials are controlled research studies that are done with patients who volunteer to participate in them to look at new treatment options or procedures. This slide shows the stages of colon cancer and demonstrates the size of the polyps and how they attach and grow through the layers of the colon lining. The first thing you should do is make an appointment with your physician if you are close to the age of 50, or if you have a strong family history of colon cancer. It is never too late. Begin eating clean and making healthy food choices. Begin an exercise program, stop smoking, and limit the amount of alcohol you drink. This will put you on the right path of beating this treatable colon cancer disease.